Recent studies have shown that undetected non-convulsive seizures and non-convulsive status epilepticus are significant problems occurring in the ICU. The clear indication is continuous brain monitoring provides better outcomes. Fortunately, continuous EEG monitoring is now easy to implement in your ICU. It creates a new revenue stream for hospitals while offering patients better care. To find out more, please watch this important 3-minute message from Cadwell. Medical professionals are increasingly aware that non-convulsive seizures and status epilepticus are going undetected in their ICU patients. A sampling of studies reveals non-convulsive seizures occurring in 22% of severe head trauma patients and 34% of neurologic ICU patients, of which over half were in non-convulsive status epilepticus. Non-convulsive seizures were found in large percentages of intracerebral hemorrhage patients. 30 and 60-minute EEG monitoring can't detect all these non-convulsive seizures. As a result, diagnoses are imprecise, treatment may be delayed, patient health worsens, and ICU stays are longer. Since it's a rising medical consensus that continuous EEG monitoring improves ICU patient outcome, why isn't this common practice? There are specific logistical obstacles and concerns. 1. Traditional EEG equipment isn't designed for continuous monitoring in the ICU. 2. Hospitals and clinics are understandably concerned about the impact of process changes to their limited budgets. 3. Non-neurological staff is concerned about the difficulty of attaching electrodes and reading EEG results. 4. There aren't enough neurologists to assess all that new data. The Cadwell Invisio EEG is specifically designed for continuous monitoring of ICU patients. This affordable, compact, lightweight, self-contained system acquires CEEG and other physiological data with a range of features, including remote monitoring and review. Because these procedures are reimbursable, EEG monitoring isn't a cost burden on your ICU. It's a revenue generator. A detailed study of the UCLA ICU showed a combination of cost savings due to many factors, including quicker diagnosis, reduced testing, and reduced patient time in the ICU, with the overall result of net profit from these procedures. We can help you determine your return on investment. What about nurses' important concerns about attaching electrodes? Cadwell offers a color-coded template that goes over the patient's head and shows you where to attach the electrodes. They're MRI compatible too. We understand that neurologists can't always be in the ICU, and nurses have reasonable concerns about drawing EEG results by themselves. Our solution can help. The Invisio provides neurologists remote access to patient data, greatly expanding the ease and frequency of neuroconsults. Furthermore, Cadwell's Invisio provides important features that nurses appreciate: the ability to establish thresholds for burst suppression, asymmetry, alpha-delta ratio, and other important parameters, with both auditory and visual notifications. In software that displays the trends in a format that's easy to understand. Neurologists already know Cadwell's reputation for affordable innovation. The Invisio EEG helps your ICU implement continuous EEG monitoring for better patient outcomes, new revenue, and easy implementation.